Okay, so we're just going to show you how to set up a COVID compliant circuit on a NiPPV Plus. We've set up packs at the minute, so whenever you're getting your machine, you'll get everything that you need for setup and then a bit of information as well. We have, I'll just go through the information that's coming out to you. So we have all the different pieces that will be in the actual pack. Just important to note that there is an extra sort of green connection that's surplus to requirements. We don't need it. And then on the other side of this page, we have the actual setup. So it goes through step by step what you need, and it gives you a visual of the appropriate setup. We'll also include a nursing observation sheet, and again, you can request these from Paul's or the respiratory nursing service, and literally it's just allowing us to monitor the parameters when somebody's on CPAP or BiPAP. For medics, there is the respiratory management pathway for COVID-19 patients, and again just acts as a guide. And then finally we just have a sort of a log so that nursing staff can document the date and time of when the filters have been changed on the machine. So that's the equipment, that's the information that comes with it. So you're going to get, as I said, everything that you need. We have our tubing, we have our filter, we have an oxygen connector, and then most importantly we have a non-vented blue strapped mask, and this is for our COVID compliant circuit. We have a non-vented blue strap mask. It comes in small, medium and large, and then I'll show you that on whenever the mask, you open the mask, you can see it at the bottom what sort of size the mask is. So I'll just show you how to put it together now. So we have ones here that are already open. So we have our sort of clear tubing, but the difference here is that we have a purple and green end to one. So we go with the clear end to the machine. And then at the purple end, we actually have an exhalation port here. This is where your patient is breathing out. This is your CO2 outlet. It's very, very important to have this in place in order to have a COVID compliant machine. Because our patients are sort of breathing out viral particles, this needs to be filtered, and that's why the next thing that gets attached is your filter. There's no wrong way of putting this on. It will go on securely. The next thing that we need is that your oxygen, your patient will likely have to have oxygen and train through this circuit. So then we're applying our oxygen connector, and again, don't worry if this will not go on the wrong way. There's one way to secure it. And then, as I said, the mask is non-vented, so there's no holes in this mask, and we have a blue slider strap here to signify that it's non-vented, and this will attach onto our oxygen connector. So we have our non-vented blue strapped mask, our oxygen connector. We have our exhalation port down here, which has been filtered, and this filter is going to be changed every 24 hours. And then we just have our normal tubing to the machine. Very important that it has this exhalation port on it. So that is the proper setup of your of a COVID compliant circuit used with NiPPV Plus.